The pelvis is the lowermost part of the abdomen. It is a basin shaped cavity like this, which is suspended by the abdominal muscles, which has got a pelvic diaphragm here, below which is the pelvis, and above which is the pelvis, and below which the perineum. It gives passage to urine, baby, and the feces, and it has these two lower limbs attached to it. It transmits the body weight through the spine, the sacroiliac joint, into the femoral heads, neck, and shaft. In one limb or in both limbs stands face. Now, let us begin at this level and show you that this is the lumbar vertebra, this is the neural canal, this is the transverse process, the lamina, and the spinous process. And we have a fascia which is trilaminar. It's attached to the tip of the transverse process, the spinous process, and the anterior half of the transverse process, which forms the thoracolumbar ligament. Now this thoracolumbar ligament gives rise to two muscles, the transversus abdominis and internal oblique, and they go to the anti-abdominal wall. The transversus, the internal oblique divides into two, ends in the linea alba, and encloses the rectus abdominis. Outside the internal oblique is the external oblique, which ends here. On this side is the latissimus dorsi. Here muscles are the sacrospinalis, and this is quadratus lumborum. Now, the fascia transversalis lines the abdominal wall like this. It comes here, it encloses the psoas muscle, it goes back, encloses the kidney, and goes on the opposite side. So this fascia which encloses the kidney is called as the Gerota, fascia of Gerota. And here you have another muscle which is the psoas major. Here of course you will have the skin and the subcutaneous tissue, and therefore after dividing skin, subcutaneous tissue and thoracolumbar fascia, you can evacuate a psoas, you can reach the kidney, or you can evacuate a psoas abscess just by dividing this thoracolumbar fascia. And if you look at the space between the external oblique and the latissimus dorsi, you will have to make the iliac crest, the anterior superiliac spine, the posterior superiliac spine, and posterior inferior iliac spine, the greater sciatic notch. Here is the anterior inferior spine. Then you know that in the anterior 2/3, which is convex outwards, there is a iliac tuberosity, and the muscle here up to this place is external oblique. So this is the posterior border of the external oblique. From the outer half of the posterior 1/3 arises the latissimus dorsi. So this latissimus dorsi anterior border, external oblique posterior border, and iliac crest form what is called as the lumbar triangle of Petit. And this is the approach. In the base you see the thoraco-lumbar fascia up to here, and then these transversus abdominis and internal oblique muscles arising here. So this is the approach to reach the kidney or the Psoas abscess. So this is what I want to tell you about the suspension of the pelvis from the abdominal wall. Now let us make another diagram. That diagram is that this is the spine, T12, 1, 2, 3, 4, and 5. Here is the 12th rib. Here will be the sacrum. Here will be the iliac crest, the anterior superiliac spine, the anterior inferior spine, the pectineal eminence, the notch for the artery, vein, and nerve, the pubic tubercle, the pubic crest, the pubic symphysis, the ischiopubic ramus, the ischial tuberosity. Here you will be able to see the obturator foramen. On this side we have the greater sciatic notch, the ischial spine, and the lesser sciatic notch. Here you will be seeing the sacrotuberous ligament, and here you will be seeing the sacrospinous ligament. On this side you will find that there will be the head articulating with the acetabulum, the neck, the greater trochanter, the lesser trochanter. There will be this inguinal ligament here connecting the ASIS to the pubic tubercle. Here will be the lacunar part, and here you will see this artery coming from the inferior epigastric, passing through this lacunar part, becoming the abnormal obturator and anastomosing with the. So this artery, which is lying in the lateral border of the lacunar ligament, is damaged when you are trying to fix pectineal fractures, and this is called as an abnormal obturator or accessory obturator artery, and since it bleeds at both ends, surgeons fear it and they call it corona mortis. Now we will place the crura of the diaphragm. The right crura begins at L3, goes up to 12, arches around the emergence of aorta, and comes up to L2 here. Then each of these crura, which is called as the median crura, gives attachment is attached to the transverse process, and then the rib, then the 12th rib. So this to this transverse process and then the rib. Now the diaphragm arises from this like this. The right crura gives the hiatus of the esophagus and the left crura is here, and the muscle that emerges under this is quadratus lumborum, and the muscle that emerges from under this is psoas, which passes under the inguinal ligament and is attached to the lesser tuberosity. So this is the psoas. Here you will have the thoracolumbar fascia. The thoracolumbar fascia, and from that will be originating the transversus abdominis innermost, then internal oblique, and then external oblique, the three muscles that bound the abdominal wall. And it is through this thoracolumbar fascia that you can reach the iliac fossa, you can reach the Psoas abscess, and you can reach the kidney. So this is how this pelvis is suspended from the thorax. That's why this is called as the thoracolumbar fascia.